Have you ever noticed how going to a new doctor can feel overwhelming before the appointment even starts? Even when the care itself is great, the onboarding process can leave patients stressed and frustrated. And that experience matters more than we often realize. I'm Kayla with Jotform, and in this video, we will talk about how healthcare organizations can improve the patient onboarding experience. We will walk through 3 practical ways to make onboarding easier for both patients and staff. Let's jump right in. If you are visiting a new doctor or switching healthcare systems, onboarding is probably not something you look forward to. No matter how great a healthcare organization may be, the paperwork involved in getting set up can feel like a lot. Patients are often asked to fill out multiple forms before they even make it into the exam room. But it's not just patients who feel buried in paperwork. Staff members also have to review all of that information and enter it into patient records. That process takes time and attention, and when onboarding is inefficient, it creates frustration on both sides. So, how can healthcare organizations make onboarding easier for everyone involved? One of the most effective places to start is training staff. Employees are responsible for explaining the onboarding process to patients and making sure all required information is collected. When staff are properly trained, they are better equipped to help patients complete forms correctly and confidently. A big part of this training should focus on customer service. Healthcare is also a service industry, and patients expect to be treated with patience and care. Staff should understand how to guide patients through onboarding, how to answer questions, and how to help resolve issues that may come up along the way. Training should also include clarity around when extra information is needed. Some patients may require additional forms depending on their insurance, the type of care they are receiving, or ongoing health conditions. Employees need to know when these extra forms apply and when patients can skip them. This helps avoid unnecessary paperwork and keeps the process moving smoothly. It can also be helpful to show staff examples of completed forms. If forms are complicated or employees are unsure what finished paperwork should look like, sample forms can provide helpful guidance. These examples should never include real patient data, since that would be a HIPAA violation. But mock examples can go a long way in improving accuracy. The next way to improve patient onboarding is by streamlining paperwork with software tools. Filling out forms is usually the most time-consuming part of onboarding. While forms cannot be eliminated entirely, they can be made much easier to manage. One simple improvement is by using online forms instead of paper copies. Online forms can make it faster for patients to complete paperwork and easier for staff to collect it. They also support a paperless onboarding process, which saves time and resources. Online forms can be customized by using conditional logic. This allows the form to show follow-up questions only when they apply. If a patient indicates that a topic does not apply to them, the form can skip those questions entirely. This keeps forms shorter and more relevant for each patient. Another helpful option is using table templates as a database for collecting patient data. When online forms integrate with healthcare spreadsheets, patient information is automatically added to organized tables. This reduces manual data entry and helps staff keep records accurate and up to date. Security is also critical when collecting patient information. HIPAA regulations require healthcare organizations to protect personal health data. Using a HIPAA-friendly online form builder like Jotform helps prevent data breaches and reduces legal risk. The final way to optimize patient onboarding is by designating employees to monitor and improve the process. Patient expectations change over time, and onboarding should evolve with them. Staff members who work with onboarding regularly are in the best position to identify what is working and what needs improvement. Choose employees at different levels, including both management and those who interact directly with patients. If your organization operates in multiple settings, such as clinics and hospitals, include staff from each environment. Take suggestions seriously, weigh the pros and cons, and test new policies before rolling them out organization-wide. Thank you so much for watching today. I'm Kayla with Jotform, and I hope this gives you a clearer picture of how to improve patient onboarding. Don't forget to click subscribe, and I'll see you next time.